Medical news from MedRxiv. Assessing rehabilitation systems in conflict, a policy analysis of prosthetic and orthotic services in Gaza, Palestine. The latest Israeli military operation, launched in October 2023, has devastated Gaza's health infrastructure, leaving thousands of injured civilians without essential rehabilitation care. In this context, a policy analysis of the Gaza Rehabilitation Task Force, RTF, reveals that, while the governing body has succeeded in establishing a robust policy framework for prosthetic and orthotic (P&O) services, the sector's capacity to deliver products, maintain qualified personnel, and provide consistent services falls dramatically short of World Health Organization (WHO) standards, jeopardizing functional recovery for an estimated 30,000 to 40,000 Palestinians who now require prosthetic or orthotic intervention. Gaza's health burden has been amplified by repeated cycles of conflict, with the 2023 escalation causing the most extensive damage to hospitals, clinics, and rehabilitation facilities in the territory's history. Prior to the conflict, the P&O sector operated under chronic resource constraints, but systematic data on its ability to meet population needs were scarce. The RTF, the official body charged with coordinating rehabilitation services, publishes periodic reports, technical manuals, and service guidelines, yet no comprehensive assessment of how these documents translate into real-world capacity had been undertaken. The present study therefore sought to fill this gap by applying the WHO standards for prosthetics and orthotics, a globally recognized benchmark that evaluates 4 domains: policy, products, personnel, and service provision. The investigators performed a qualitative document analysis of all publicly available RTF outputs related to P&O, including the 2023 State of P&O Services Report, technical specifications for device fabrication, and the Rehabilitation Service Delivery Manual. Each document was mapped against the WHO criteria, and the sector was assigned a rating on a 5-point scale: 1 equals non-existent, 5 equals fully compliant, for each domain. The analysis was conducted by a multidisciplinary team of health policy researchers and rehabilitation specialists, who reached consensus through iterative coding and cross-validation. The study did not involve primary data collection from patients or facilities, relying exclusively on the RTF's published material. The assessment found that the policy domain achieved the highest rating, scoring 4 out of 5, reflecting the RTF's comprehensive legislative framework, clear service eligibility criteria, and integration of P&O into the broader health system plan. In stark contrast, the products domain received a rating of 1.5, indicating severe shortages of raw materials, limited import pathways, and an inability to meet WHO-mandated device quality standards. The personnel domain was rated 1, underscoring a critical deficit of trained prosthetists and orthotists, estimated at fewer than 10 qualified professionals for the entire Gaza Strip, combined with high turnover and restricted access to continuing education. Service provision scored 1.2, highlighting fragmented care pathways, intermittent clinic operation due to power cuts, and an estimated service coverage of only 15% of the identified need. These ratings collectively illustrate a sector where policy intent is outpaced by material and human resource realities, a mismatch amplified by the intentional withholding of medical supplies and the targeted destruction of rehabilitation infrastructure. Secondary analysis of the RTF's internal monitoring data suggested that, despite the overall low capacity, certain subsectors, such as community-based orthotic fitting for pediatric cerebral palsy, maintained modest continuity, achieving a service provision rating of 2.5 in isolated pilot sites. However, these pockets of resilience were limited in scale and could not offset the systemic shortfall. Clinically, the findings signal an urgent need for humanitarian actors and policymakers to prioritize the restoration of P&O supply chains, accelerate training programs for local technicians, and safeguard rehabilitation facilities from further damage. Aligning resource allocation with the WHO standards would enable the Gaza Ministry of Health to move beyond policy formulation toward tangible service delivery, thereby reducing the long-term disability burden and improving mobility outcomes for thousands of civilians. In practice, this. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.